Hi everyone, we're Team Diabetes and our project is called GetMDPP. And the purpose of this is to connect at-risk diabetics to providers so that they can get started on a healthy lifestyle. Our project is also sponsored by Last Mile. I'm Raksha and my other team members are Alex, Peach, and Shravan. So according to previous research done, 34.2 million people in the US have diabetes, which is roughly 10.5% of the US population. And on the other hand, 88 million people aged 18 or older have prediabetes, which is 34.5% or 1 out of 3 adults in the US. To give a little background information on this problem space, type 2 diabetes is when the body can't use insulin well, and it's also the seventh leading cause of death. As I said before, 1 out of 3 adults in the US have prediabetes, and of those, 8 out of 10 don't realize they have it. And for those who don't know what prediabetes is, it's where your blood sugar is high, but it isn't high enough to be diabetes. And so another major problem is that a lot of people who may be at risk aren't really aware of how to get started on lowering their risk or knowing how to be connected to a provider to start preventing it. So we wanted to explore this problem space and ask the big question, how might people who are at risk of type 2 diabetes with Medicare get in contact with the prevention providers so that they can get started on managing their lifestyle better?
Through talking with healthcare professionals and those who have been in diabetes prevention programs, we found that it was harder to start diabetes prevention programs than to continue them, and that it was important to spread awareness about type 2 diabetes because it's very information dense, and when the users learned about diabetes, it incentivized them to start the program. We also learned that it was important to display diabetes information clearly and make it easy to understand because our main users are around 65. One of our user personas is Jim McKenzie, who is 66 years old, pre-diabetic, and he's not sure if he qualifies for Medicare coverage. In our user testing and validation, we tested with a variety of people, including people with diabetes and people currently living in a diabetes prevention program. Users should be able to find providers in their state/city and take an assessment that checks whether they're qualified for Medicare. We also found that the project should be easy to navigate and accessible on multiple devices.
Around 10% of the US population has diabetes, and 34.5% of young adults have signs of prediabetes, with these numbers continuing to rise. And although it is preventable with healthy lifestyle changes, reaching out for help has become more difficult, especially during these times. Building off our sponsor's progress, we met with an epidemiologist, economist, healthcare providers, and people in or have taken a diabetes prevention program in order to create GetMDPP, a web-based matching application designed to help people at risk connect to diabetes prevention providers. With GetMDPP, you can search for providers in your area, learn more about diabetes and Medicare, and take an assessment to see if you qualify for the Medicare Diabetes Prevention Program. GetMDPP provides ways for people at risk to connect with providers and get the help they deserve.
The ethical considerations that we took while going into this project was one, to respect the privacy of our users. And second was to ensure that the data that we are collecting from the users about their responses isn't being misused in any way. And third, to always make sure that the user is aware of where the data is going and what is collected and how it's going to be used through the means of a privacy statement. So the next steps that we're looking at for this project is that our team will be providing all the necessary documentation to our sponsor Last Mile about how backend and front end was planned, what data was collected from the users, and for what purpose the data can be used. Using this documentation, our sponsor can continue implementing more features to improve the assessment on the GetMDPP website and use the data collected for analysis about type 2 diabetes. Thank you.